How to help someone with minor bleeding. A cut is a wound where the skin has been split open. The edges of the cut can be jagged or smooth. Scrapes are wounds where the skin has been rubbed or scraped away. Cuts and scrapes may be painful and bleed. Cuts and scrapes don't usually need emergency care, but you should call 911 or your local emergency number if you think the person might have more serious injuries. If the person is bleeding a lot, apply direct pressure until they stop bleeding. Rinse the wound for 5 minutes with clean running water. Some wounds need to be stitched by a trained medical professional. Stitches help the wound heal faster, lower the chances of infection, and leave a less noticeable scar. The wound may need stitches if it's longer than 2.5 centimeters, is near a joint, on the person's hand, foot, or face, or the edges of the skin don't touch. If you think that the wound needs stitches, advise the person to contact a care provider. Stitches should be done in the first few hours after the person got hurt. Bandage the wound. Infection. Advise the person to watch for infection over the next few days. If a wound is infected, the area might be red, hot, warm, swollen, tender, or very itchy. There could also be pus or red streaks moving away from the wound. Advise the person to contact a care provider if they think their wound is infected. As a reminder, the basic steps you should take when a person has a cut or scrape are: Step 1. Apply direct pressure if the person is bleeding a lot. Step 2. Rinse the wound for 5 minutes. Step 3. Bandage the wound. Advise the person to contact a care provider if you think the wound is infected or needs stitches. Confidence to act, knowledge to respond.